there's a spectrum related to the degree to which pharmacists have been trained in their entry-level degree, as well as how much they've done after they've graduated. And so I think if we're talking about clinical training, it's really important for each pharmacist to be thinking about this in terms of continuing professional development. Assess your competence. If you see gaps, then seek training to address those gaps. And then also recognize that there may be baseline training needed for policies and procedures for implementing a quality measurement program in the pharmacy.
Welcome to the Pharmacy Quality Solutions Quality Corner Show, where we believe that quality measurement leads to better outcomes. Let us become your go-to source for all things related to quality and medication use in healthcare. We will hit on trending health topics as they relate to performance measurements and find common ground for payers and practitioners. We will discuss how the EQIP platform can help you with your performance goals, and we will also make sure to keep you up to date on pharmacy quality news. So buckle up and put your thinking cap on. The Quality Corner Show starts now.
Hello, Quality Corner Show listeners. This is your host, Nick Dorich, and we welcome you to another episode of our podcast. Last week, we kicked off our series on PQS's 2020 Trend Report, covering the section on patient perceptions about pharmacist-provided services. To give a quick recap, while many patients believe and are comfortable with receiving services from a pharmacist, there are some questions from patients on the training and expertise of pharmacy. Pharmacists have always done a great job within our own circles concerning the value of our work, but there are still more efforts for patient education that need to occur. Hopefully, this serves as a call to action to work and educate our patients, our members of the community, and of course, with our legislators. Before we go into today's section of the Trend Report, let's make sure you know about the context of the report. First, please go to our website, pharmacyquality.com, to download that report. The 2020 report is the second consecutive year in which the report has been published, and that means for historical information or context, you can also go back to view the 2019 report. The Trend Report focuses on three key sections of survey results. The respondents of the respective components include patients using pharmacies, both chain pharmacies and independent pharmacies, which is found in the pharmacy readiness section. And we also survey health plans in a section called payer challenges and opportunities with performance improvement. We're going to dedicate an episode to each section of this report. That means there will be one final episode about the Trend Report, which will be available next week, and that will cover the final portion of the 2020 Trend Report. Now, with that covered, let's talk about pharmacy readiness and our findings from the 2020 Trend Report. Like many of our shows, I would like to introduce a guest to help us explore the topic today. And today's guest is a true pharmacy expert. Please allow me now to welcome Ann Burns, who is the Vice President, Professional Affairs at the American Pharmacists Association. Ann, welcome to the PQS Quality Corner Show.
Thanks, Nick. I'm beyond excited to be here to discuss this report. I think there are very, very important learnings for pharmacists, not only for the survey of pharmacists and how pharmacists can impact, but also the information that was gleaned from the report from consumers and payers. So really excited to be here today.
And I'm also very excited to hear that. And before we start our discussion for today, our audience should learn about your experience and your commitment to pharmacy practice. So do you mind sharing about your current role at APhA, your background in pharmacy, and also your vision for community pharmacy practice?
Perfect. Thank you. Well, I'd like to start by saying that I'm passionate about the expertise that pharmacists can contribute to helping patients and the difference that they can make in patients' health. And I think they bring unique medication-related expertise to the healthcare team that can be used in managing chronic conditions, but also in prevention and wellness. And I would also say I strongly believe pharmacists are underutilized, and we have a tremendous opportunity to contribute in more meaningful ways. I also would like to say that I'm in awe of contributions that pharmacists make every day, and especially over the past year, really the pharmacy heroes on the front lines have really shown the value that pharmacists can bring to the healthcare system. I have kind of an unusual background. I have a background in independent community pharmacy practice. I also was in academia at my alma mater, Ohio State University College of Pharmacy, the Ohio State University College of Pharmacy for a number of years. And I've spent the last 23 plus years at the American Pharmacists Association. And at APhA, I am in the professional affairs and practice area. It's a very exciting role where I get to see a lot of amazing things happening in a variety of pharmacy practice settings across the country and interface with a lot of innovative pharmacists. Many of the areas that I'm responsible for relate directly to this report. So advancing a variety of different parts or types of pharmacist patient care services, focusing on improving pharmacist scope of practice, payment for their services, including value-based payment, the need for the ability and the capability to exchange electronic health information. I've spent a number of years in the quality measurement realm, and I also focus on other collaboration with other healthcare providers. My past year has focused extensively on COVID-19, and I also do a lot of work in the opioid epidemic realm. So lots of different things, something new every day, and it's just a great place to work.
And it sounds like you have lots of free time on your hands. But I do thank you for that introduction. And it's important to call out, looking at the last 20 years, pharmacy practice, pharmacy services, it's very easy to say that not much has changed in pharmacy, or that we're not seeing a difference. But if you look over that period of time, we have seen expansion pharmacy services. We have seen more capabilities and being able to bill for medication therapy management services, immunizations. I was at the University of Rhode Island in 2007, when Rhode Island was one of the last states to allow pharmacists to administer immunization. So if you look over the last 20 years, again, there's a lot that has been updated for pharmacy. And I'll point out, there's been a lot that's been updated on pharmacists being able to provide services, be paid for those services. And we're continuing on that track. And I think that's what we're going to, talk about today. What are those next area of services so that pharmacists, we're always going to be dispensing and managing medications. That's well and great. But we're going to explore other areas where pharmacists are trained and capable to provide services and be paid for providing those services to patients. Now, before we get into our questions, I'll provide a quick overview of what comes next. Ann and I have 3 questions that are written down for us to explore today. I'll go down the list, ask the first question, and you'll get a response, and then we may have some back and forth to summarize the key points. We're going to repeat that process for the second and third questions, and then we're going to wrap up our primary content for this recording. When we get to the end, we'll have an exciting closing and summary. And with that, we've now described the process, so I'm going to go ahead and jump us into question 1. And the intent with this section of the trend report was to understand how the pharmacy industry is preparing to support services and capabilities of pharmacists to be more engaged with patient outcomes. The responses in this part of the survey were provided by pharmacy organizations representing both chain and independent pharmacies. So of course, this includes your box store pharmacies, your grocers with pharmacies, your mass merchants with pharmacies, and of course, as I referenced, those independent pharmacies, so more than 20,000 of those that are out there. Those that responded with the survey represent more than 29,000 pharmacies nationwide in the US. So we've got a pretty good group of folks here representing pharmacy organizations that are providing their indications on what they see for pharmacist provided services. And what did we find out about pharmacies and their confidence related to how pharmacists can improve patient health outcomes for outcomes-related quality measures and intermediate outcome-related quality measures? And what are we seeing that's already being used?
So, Nick, I've been working in the value-based payment realm for over 10 years, and I was very, very encouraged to see in the results of this survey the progress that is being made in pharmacy, the confidence that pharmacists can impact measures. The results of the survey were to be expected, from my opinion. Pharmacists were most confident in improving intermediate outcome measures. Intermediate outcome measures are the measures that frontline pharmacists are seeing in their dashboards. They're predominantly adherence measures and for instance, for diabetes and cholesterol and blood pressure, and also some measures around gaps. So does a patient have diabetes, and should they be on a statin, and is a statin not in their regimen? These measures are commonplace in dashboards now, and they're also measures that, from my perspective, are fairly easy to impact and integrate into pharmacy workflow, especially if you're being incentivized to improve the measure. It's easy to talk to patients about their adherence and to move the measure. So I was really not that surprised to see that intermediate outcome measures had the highest percentage in the survey. Around 40% of respondents felt confident in impacting those measures. I was ecstatic to see that almost a third of respondents felt confident that they could impact both intermediate and outcome measures. Outcome measures are the gold standard. Are we really seeing a direct health effect? So measures like controlling blood pressure and controlling diabetes are outcomes measures. And almost a third of respondents felt like they could confidently impact both intermediate and outcome measures. It's notable that about a third of the respondents weren't comfortable and confident about impacting either intermediate or outcome measures. And I think that just shows that we still have work to do. This is a difficult process for the entire healthcare system. And so the results weren't surprising, but they were also exciting at the same time.
And I'm going to ask this part. This is your opinion based on your interactions with pharmacists and with pharmacy leaders that are out there. So this is not directly related to the trend report. But what helps us to improve that confidence and for pharmacists with outcomes-based measures? From my standpoint, I think it may be related to expanded scope of practice for pharmacists in terms of screening, being able to, do and manage A1C test or blood pressure or, stat or cholesterol panels, et cetera. There may also be a part of it that is related to pharmacist prescription or prescriptive authority, being able to write those under the appropriate practice guidelines. But I'd be curious from your standpoint, do you think that makes a difference in why we need to look at pharmacist scope so that we can get more involved with those true outcomes-based measures?
I'm shaking my head yes, even though we're on audio. So I agree with what you're saying. I think scope of practice definitely plays an important role. And we'll likely talk about this at some point during the podcast, but I think there's also some practice infrastructure that needs to be built so that pharmacy practices feel comfortable with understanding what all of this means. I also think that there's a gap in pharmacists' understanding of how quality measures work and how they can effectively improve them. So we're working very much on the education component, but this is just such a relatively new area in the healthcare system. So it's really an across the board answer where we need scope of practice. we need the payment to be meaningful and delivered in a way that it can support the pharmacy practice. And so we're learning a lot as far as how does value-based payment work and what's a good contract for a pharmacy to enter into and how much risk the pharmacy should take on. So there are a lot of factors at play, but certainly the scope of practice that you mentioned is also very important as well.
The payment's a really key aspect, and that actually leads us into our second question. And results from the survey about methods of payment or payment methodology, what the structure of payment is related to pay-for-performance programs. There's no one-size-fits-all. In a fee-for-service model, it's right, you do the service, you get paid. It's a transaction, clean and simple. Value-based payment is inherently different, and there's a number of models that can work and that are valid value-based payment models. I'm really interested in it from a quality improvement standpoint. And as we get more research, are there models that tend to show better results? Are there models that are more provider friendly, cause less stress on the providers or the patients, et cetera, et cetera? We're going to get there. That's a conversation for a whole nother time. But related to the trend report and pay for performance programs, they do come in many forms. And overall, we're seeing that shift from fee for service to value-based payment. The pharmacy community, from the results and what we saw at the trend report, seems to favor a hybrid approach where there's some aspect that's fee for service. So essentially you're receiving a base, you're providing a service, you're going to get some basement level fee for providing that. And then based on performance, there's a variable rate that can get you additional dollars, et cetera. What do you think about that? And what does the survey tell us about these hybrid models for payment? Are there similar types of programs that insurers or CMS use with other types of providers? Because I think that's a really interesting aspect. Value-based payment for pharmacy is relatively new, but value-based payment is 30 plus years old in healthcare. So there's other models we can learn from.
Sure. So I will also say I was encouraged to see the results in this question. By far, the respondents felt that a point of service fee for service model. So you're getting, as you mentioned, Nick, paid directly for delivering the service that also has an end of the year performance payment was the model that they felt most confident with. And I kind of refer to this as your dip the toe in the water. Everybody's very comfortable for getting paid, as you mentioned, for delivering the service. But once you start moving into the realm where you have to meet a measure to get a certain level of payment, it becomes you're taking on more what we call risk. And so it becomes more unknown, and the unknown can always be scary. So this model was the one that was most respondents felt most confident in. The model they felt the least confident in was, which is totally understandable, would be you get an annual payment and you deliver the care to everybody over a year. That can be very uncertain, obviously, because you don't know what the health of your populations are going to be like. I will say that these models are becoming very well established in the physician community, the hospital community. I'm sure that many of the listeners have heard of the MIPS program and advanced alternative payment programs through CMS, which has become the standard for how physicians who participate in the Medicare program are paid. And there are a number of health plans that are working with community pharmacies, and it's very exciting to see on different types of value-based payment arrangements. And some of them might be you're paid a fee per month to manage the patients, and you get an incentive payment at the end for meeting certain metrics. So there is a wide array of different types of models being used. And I would say in many respects, we're still in an experimental phase as far as what works and what's effective. Do we have the right measures? Are we measuring the right thing? But I think the reality, and a lot of value-based payment was reporting for it was placed on hold during the pandemic because it was an all hands on board approach. So even in the CMS programs, providers got a reprieve from having to do their quality measurement reporting. But what I'm seeing as we're getting a better handle on the pandemic is that the emphasis on value-based payment is becoming even more predominant. And so I think as pharmacy, we need to really make sure we're on board, that we're not left off the train as this moves forward. And as we learn more about taking on risk, I think it's really an excellent opportunity for pharmacists who unfortunately have not been part of many of the fee-for-service programs for their clinical services. It's been a real struggle for us. But as we move to a situation where providers are paid based on their ability to improve patients' health, this is a golden opportunity for us. And I think it's something that we can't ignore, and that we really, really need to take advantage of.
And you referenced MACRA, MIPS, and those types of program design becoming the standard for payment for physicians under the CMS program. But that's expanded with other types of programs, not just CMS or federal programs with physicians and other providers. I want to put a big exclamation point, probably multiple exclamation points to that, because when we being pharmacy, talk about being a part of the healthcare team, we want to be seen as healthcare providers. There's a recognition that we need to absorb that there is a standard process and a standard methodology for healthcare provided services, and that is around value-based payment. So for we as pharmacists, if we want to be seen as a healthcare provider, if we want to be able to provide and bill for services like a healthcare provider, we need to be comfortable working with quality measures, or at least comfortable with working with the data on quality measures. Now, earlier in response to the first question, you referenced training and infrastructure for how pharmacists support that, and where still some work needs to occur. So that actually transitions us perfectly to our third question. And this is related to training and needs for pharmacists to support outcomes-based measures and payment programs that reflect pharmacists' efforts. So just because we have the skills and we have the knowledge, it doesn't mean that our workflow and our operations and how patients interact with us, or how we need to get that data to providers, it doesn't mean that those systems are already set up in place. So we have some bridges to build before we can cross those bridges and get to that promised land. I'd like for us to explore from the trend report and from your information, your background on this. Did our respondents find that additional training for pharmacy staff members would be needed to support more value-based payment arrangements or outcomes-based measure support? Is there additional support or infrastructure that's needed? Do pharmacists need to get comfortable with documentation for patient services? What work needs to be completed? Because this, to me, is perhaps the most important thing. It's something that pharmacists, as a profession, we completely control these details to it. And for us to be able to go out to patients and to be able to go out to payers to show that we can do this, we need to handle these things ourselves. So what are your thoughts on what we need to do to get us to that next step?
Sure. Well, just from a survey perspective, about 2/3 of the respondents to the survey felt that some additional training was needed. So I think the emphasis there is on some. And I would say that this is not surprising. They also had the opportunity to indicate if they thought substantial training was needed, and a very small percentage of respondents answered that they thought substantial training was needed. My question, because the survey always breeds more questions, is what kind of training are the respondents thinking about? Is it clinical training? Is it training on, as you mentioned, on how metrics work, and so forth? So I would just say that sometimes it feels like the term training can be a contentious issue in the profession, around whether it should be required or not. But I would just say that I prefer to think about training in terms of continuous professional development. So like any other healthcare professional, we as pharmacists, have an obligation to the patient to be competent in the services we're providing. And so when we look across the spectrum, or across the professions, there's a spectrum related to the degree to which pharmacists have been trained in their entry-level degree, as well as how much they've done after they've graduated. And so I think if we're talking about clinical training, it's really important for each pharmacist to be thinking about this in terms of continuing professional development. Assess your competence. If you see gaps, then seek training to address those gaps. And then also recognize that there may be baseline training needed for policies and procedures for implementing a quality measurement program in the pharmacy, or maybe for coming up to speed on a specific clinical service. So I don't think those results are surprising, and I think we should honestly embrace them. We want to make sure that we can deliver, and training plays an important role there. I'd love to spend just a second on your question about additional support, because there's really a lot that needs to happen related to transforming pharmacy practices to be able to deliver value-based services and be paid for them. And so just a couple of high-level things. I think you said it, Nick. We need effective documentation systems that are also efficient, and pharmacists need to understand what they need to document in order for their services to be measured from a quality perspective, and why it's so important for that documentation to occur. Equally critical, and this has come up a lot as we've looked at measure development for community pharmacies for more robust services like blood pressure management or even blood pressure screening. Pharmacies need to be able to exchange clinical information with physician practices, with hospitals for transitions of care, because there is some important information that community pharmacies often don't have that they need in order to provide effective care and coordinated care for their patients. So there's a lot of work going on with the Pharmacy HIT Collaborative to make that happen. And a lot of community pharmacies are implementing electronic health record systems that allow them to exchange information. So that is critically important. And then I'll get on my soapbox for just a minute.
Yeah, please do.
We need to think about the pharmacist being able to deliver these services like other healthcare providers do. So we really need to look at workflow. Pharmacists need dedicated time if it's a service that's more than a couple of minutes. We need to have the pharmacy set up physically so that the pharmacist can sit down with the patient and deliver a service like patients expect to receive from other providers. We need to think about appointment-based services so that dedicated time aligns with when patients are being seen. And I think we've kind of started to go a long way to that end during COVID, where there has been a need because of physical distancing to promote appointment-based models, even for services that have traditionally been walk-in like vaccines. So it's very doable. We can do it. There's a lot of great work happening in the profession, but it's not just, can I conduct these measurements? We need to have the systems and the infrastructure built in the pharmacy in order for that to happen. And then the last thing that I would say, and I'll get off my soapbox, is as pharmacists, especially if we've been primarily in a dispensing role where the focus has been on the prescription that is in front of the pharmacist and how it may be interacting with other meds that the patient is taking, we need to take a step, I think a more global step, and really look at the patient as a whole. So we need to be thinking about what are all of those things, like does the patient have transportation? Can they afford their meds? So a more holistic approach, because all of those factors are going to weigh into whether or not clinical metrics are being met. One of my roles on the personal side is that I'm a caregiver. So I'm in a pharmacy several times a month. And my pharmacists are great. I love them. As we move into more value-based care, what I'd like to be hearing are, how are your medications working for you? Just as a start into, let's start to delve into a little bit deeper what might be going on with the patient in front of you.
Change is not necessarily a bad thing, but it is change. And a metaphor that I use with some folks is around the education, and why that's important is we're going to get better. So it's incumbent on us to better understand how we can provide services, the best treatments. So I'll give a quick metaphor here. If you took a firefighter in 1890 and suddenly transported them to 2021, they wouldn't really be good at their job per se, right? Because so much of how a firefighter is going about their job has changed with technology, water pressure, ways to get that water on the fire, and how they're controlling airflow that's there, right? So, I mean, if we're changing this or using this metaphor analogy with pharmacy, a pharmacist and how they practiced in 1890, very different from how they're practicing in 2021. And it's not just the medications that were being used at the time. I don't. Back in 1890, I'm not really sure there were any specific medications that were being used at that point. More herbal remedies likely the case. But the point being is that it does come down to delivery, but then also medications that are used. Now, I graduated from pharmacy school in 2011, and from that time to now, a decade, there's been some changes or updates in medications that are optimal or are best for treating patients. For those pharmacists that are, I believe the correct term is more seasoned than I am, for a lot of their career through the 80s and the 90s, even the early 2000s, there were so many medications that were coming to market, and it was a mountain to climb up to learn about these new medications. But there's not as much new medications that are coming to market, and when they are, they're often specialty medications. Excuse me. It doesn't mean for our pharmacists today that we're not learning. It's just that we're shifting from learning about these new medications, shifting more towards how we're optimizing the care, how we're optimizing documentation, working with other providers. So, and I don't know if you have any other thoughts kind of on this process or anything else you want to add before we wrap up on our questions.
I totally agree with your comments, Nick, and appreciate that you use the word seasoned, since I fall into that category. But I just would reiterate that there is a lot of opportunity for pharmacists. There is significant interest among payers, government agencies, and so forth, in leveraging community pharmacies in particular, because of their accessibility, the relationships that pharmacists in community pharmacies have with their patients. And so we can't ignore that. And I think it's something that we need to embrace and promote. And we're seeing even this playing out with COVID vaccines, the focus on underserved communities in many counties in the country. Community pharmacies may be the only healthcare destination. How can we leverage that as a profession to help provide services that we may not have traditionally been providing to patients in the community pharmacy setting?
One other thing, Anne, I'd point out about this, and I've been recently doing some reading in my free time about negotiation and how to manage that effectively. The most difficult steps in negotiation are, one, getting your foot in the door and getting the attention of that person you're trying to negotiate with, and two, trying to close the deal. I bring that up now because for pharmacy and providing enhanced services and getting paid for other services, I really, truly believe we're approaching that precipice of closing those negotiations and reaching that watershed moment. So that the fact that it's getting harder and more in depth with these conversations and negotiations with payers and legislators, to me, that's a sign that, hey, we're almost there. We got to keep pushing. Don't give up now. We've done the work. Let's make sure we get it across the finish line. Now, Anne, I do appreciate you talking and walking us through the survey results. And as you spoke, there were a couple words you mentioned multiple times about their survey results: excited, ecstatic, and what that means. We're things are going positively for the pharmacy profession. We're getting there. We know pharmacists are the medication experts, and with medication utilization being what it is, more patients than ever are taking medications. That's simply a fact, and that's for chronic and acute disease states. If a patient is utilizing medications, they should be consulting with their pharmacist, and pharmacists should be recognized and paid for those services provided. This is an audio medium, but Anne is nodding her head emphatically as I state these things. And with that being said, we still have a lot of work to do so that patients understand what a pharmacist does and why they should view and use their pharmacist like any other healthcare provider. That is a whole nother topic of discussion that we can cover at a later time, and I'm sure we will. But Anne, before we wrap up today, I would like to get another question for you. We usually wrap up with something that's a little bit more lighthearted and fun. And one thing about you, Anne, that I'm very familiar with, you mentioned in the beginning, you are originally from the state of Ohio, and that you are a proud Buckeye. Ohio, I'll spare me this quick joke, but I feel like Ohio is known for really great things like pharmacy practice. The Ohio State football team, although did not go that well recently in a big game. Other sports teams like that baseball team or that football team leave a little bit more to be desired. But let's talk about those good things with Ohio. Ohio is a pretty innovative state and unique state for excellence in pharmacy. So when I look at Ohio, what's going on, and I look at other states, it's difficult to discern what is it about Ohio and its practice of pharmacy. Is there something in the water? Is there something about the education that's there? What can pharmacists in other states learn and emulate from pharmacy practice innovation Ohio so that we can push the profession forward?
Thanks, Nick. And I would say currently, a couple of days out from our football game a couple days ago, I'm a proud and sad Buckeye, but ultimately a proud Buckeye. And I would also say I'm very proud of the work that's happening in Ohio because there are some really exciting innovations there. And there are a number of states that are also really, I think, innovating and maximizing the use of pharmacists and getting recognition for payment. Some of the observations that I have that are true for Ohio, but also true for some of these other states that are on the cutting edge are, number one, there's a lot of advocacy, grassroots advocacy and engagement of pharmacists to both expand scope of practice and to advocate for payment. And the pharmacists have really leveraged the physician community in many cases to either be neutral or to support their legislative and regulatory efforts. So really getting others, including patients, to advocate for pharmacists can be some of the most effective strategies in moving some of these initiatives that we've been working on for so long. Also, there are a number of pharmacists who really are willing to go outside the box and experiment and innovate in their practices. And some of it, in Ohio, some of these pharmacies that are participating in their payment models, have not really been that involved in sitting down and working with patients on gaps in care. And they're just coming forward admirably, and they've had great relationships. They've just been able to take it to the next level because they are now being incentivized to do it, which allows for the time that's needed. And obviously, to me, the payment piece is critical. We have been a well-meaning profession that forever has been providing a lot of services for free, or the services have been part of dispensing fees, but because of just the razor thin margins in dispensing fees are not, it's not viable to do that anymore. So the states, and I think there are 7 or 8 of them now, that have leveraged legislative activity to be paid for their services either by a state Medicaid program or state commercial health plans, are going to start to really, I think, move the ball a lot quicker. A lot of the health plans are really seeing that pharmacists can make a difference. And so if a national health plan is working with Ohio and several other states and they start to see the results, then I think we'll see a snowball effect where maybe private sector payers are paying even though there's no mandate for it. So those are just some of my observations. I would just put out a plea that it is so important for pharmacists to be actively engaged with their state association and their national association, hopefully APhA, but all of the national pharmacy associations are working diligently to make this happen. And going back to your analogies, around the 1800s, we also had blacksmiths that are no longer around. Firefighters are awesome and have transformed amazingly, but, we don't want to be blacksmiths. We want to be the firefighters.
Yeah, and that's absolutely the case. A phrase that means a lot to me as it relates to pharmacy working, we're one team.
Yep.
We are one team for providing healthcare, and we're a team that's built around the patient. That's the ultimate goal. So that being said, we do need to be working with patients. We need to be working with providers. We need to be working with legislators so that everybody knows that the pharmacist doesn't need to be on the bench, right? We want to be on the baseball field. We want to be getting a chance to swing the bat. Let us in there. Let us do our work, and we're going to produce some meaningful results that help improve patient outcomes. But yeah, we are one team. We're there with you, and we're looking forward to that kind of engagement. And I would like to thank you again for joining us on today's episode of the Quality Corner Show. And before we close, if someone does have a question for you about what we discussed today, about how they can get involved with APhA, you mentioned states where pharmacists are getting paid about services, folks may want to tap into you for that information. How can they contact you?
And I would welcome that, Nick. So thank you for allowing me to provide the information. Email is probably the best way to contact me. So my email address is aburns, ABURNS, at aphanet.org. So that's A, P as in Paul, HA, N as in Nancy, E, T as in Tom.org. I would also welcome talking to anyone who's interested in how they could become more involved with APhA. We do have a medical home accountable care organization special interest group that is focused on value-based payment models and involving pharmacists in all practice settings, and also any other areas of interest where someone might be involved with APhA. So sincerely appreciate the opportunity to be on today's episode and look forward to more of these trend reports, which just helps provide more information to eventually lead to pharmacists' wide-scale integration into value-based models.
Thanks, Ann. I have to admit 2 things. One, completely incidental that I gave metaphors about firefighters and your last name Burns. Not intentional on my part.
Touché.
And then 2, as Ann had mentioned, getting involved with APhA. If you do contact her, I at least from my experience, I can assure you, she will find a way. She will convince you that you have to be engaged, and she will find a way for you to be involved with some volunteer opportunities. I certainly have been very thankful and express my gratitude, Anne, for your help in getting me into, I guess, for finding work for me to do. Not often. Usually, people may or may not be thankful for having more work to do, but ultimately for pharmacy and payment for services, that's what we're asking for as well. So I think it's a good way to reference here. We want to have more work to do. We're gonna get there. But Anne, again, thank you. We've now officially finished our content for today's episode. And Anne, thank you for joining us. Thank you for your commitment to patient care. Thank you for your commitment to pharmacy practice. As a reminder, this is episode 2 in our series as we explore opportunities for pharmacy based on the results of the 2020 PQS Trend Report. Next week, we're going to be speaking about the survey results from payers and health plans, so stay tuned for that. That's a different perspective, and I really recommend that all of our community pharmacist listeners join in. But if you're on the payer side of the community, of course, we're going to welcome you in to see how you can engage with your pharmacies. So with that, I again appreciate you, our audience, for listening to the Quality Corner show. And there is one final message from the PQS team.
The Pharmacy Quality Solutions Quality Corner show has a request for you. Our goal is to spread the word about how quality measurement can help improve health outcomes, and we need your help in sharing this podcast to friends and colleagues in the healthcare industry. We also want you to provide feedback, ask us questions, and suggest health topics you'd like to see covered. If you are a health expert and you want to contribute to the show or even talk on the show, please contact us. You can email info@pharmacyquality.com. Let us know what is on your mind, what we can address, so that you are fully informed. We want you to be able to provide the best care for your patients and members, and we wish all of you listeners out there well.